Great, ladies and gentlemen, I want to give you a very warm welcome to the former First Lady of New York City, Chirlane McCray.
Wow, hi everyone. I said, hi everyone. Hi. So good to see all of you. You are wonderful. Thank you for the work you do, and I have to say you're also wonderfully attentive. You must be ready to change gears. You must. So I'm going to ask you to stand up. Please, everybody stand up. Take a stretch. I recommend lacing your fingers together, putting them up over your head, leaning to side, from side to side, back. Just feel the stretch. You know what they say about sitting, right? It's not good. Not good. You can stay standing for a minute. I think it's important. You get a break. While you're stretching, I'm going to ask you 3 questions. Is your brain part of your body?
Yes.
Everyone seems to be united in that answer. All right. Are your emotions also expressed through your body?
Yes.
Good. All right. We're moving in the right direction here. So why, and this is a rhetorical question, why exactly is mental health treated as something separate from healthcare? Why? It makes no sense, right? Well, you know, I believe that there is no health without mental health. That should just be like kind of written everywhere. And I'm not going to talk about mental health today, but when I talk about healthcare, I mean mental health care as well. Just want that understood up front, all right? Okay, so if you like, you may sit down. And I love this crowd. I've been around most of the day, and y'all are just amazing, really amazing. I think you should give yourselves a hand. In just a few minutes, we're heading to happy hour to catch up, to laugh, and drink in everything that makes this work so fulfilling, which is really connecting with others, right? But first, I'd like to acknowledge that Blooming Health has created something really important here. A space to wrestle seriously with access. A word that for too many people means the difference between life and death. We've had terrific speakers today who brought clarity and conviction to the work ahead. So many terrific speakers. My brain is like exploding. Dr. Diana Ramos, who challenged us to use technology as a tool for scalable empathy, reducing friction for frontline workers while keeping people at the center. I love that term, scalable empathy. Andy Slavitt, who made the case for moving from lucky catches to never-miss systems through smart automation and cross-sector collaboration. And Drs. Chelsea Clinton and Ashwin Hassan, who offered grounded, practical strategies for modernizing public health and closing the equity gaps that still define too much of the American healthcare experience. I thank them, and I thank you all again. You really can't be thanked enough for being here. Everyone who contributed to this day really should be, I wish I could just like throw $100 bills out into the audience to reward you for what you do, because you are so deserving. And the next steps to doing this work really ask something of all of us. The work is not over. So look around this room. Take a look, everyone, just look. Every sector that is represented here uses the word access. It's not even that big a word, right? A-C-C-E-S-S, access. But we don't all mean exactly the same thing by it. Not yet. For some, it means coverage. For others, it means proximity. For other people, it means utilization. But from the perspective of the people we serve, access means something more concrete. People ask, did someone identify my need? my need actually get resolved? If the answer to any of those questions is no, then access has failed, no matter how good the system looked on paper. So step one to doing this work and providing healthcare efficiently, effectively, really depends on agreeing on a definition for access. And alongside that, I think we need a shared vocabulary. Because when it comes to the barriers that people have with getting their needs met, we often speak different languages. A housing issue might be called a social determinant in healthcare. A case management issue in community services, and in public safety, it's called a risk factor, right? And that makes it really difficult to communicate. These are not just semantic differences. They create fragmentation, they prevent data from connecting, and it makes collaboration really harder than it needs to be. And then once we agree on what access means, the next question is, how do we deliver it consistently and at scale? We don't always need new programs, but we do need better systems. You've heard that a lot today, I know. I think all my best lines were taken already. It's a little distressing. But we do need better systems. And full circle care, or closed loop care, whatever you want to call it, means a need doesn't disappear into a referral. It stays visible until resolved. So let me share an example. Imagine a church in Crown Heights, Brooklyn. The pastor notices that several congregation members are struggling, not with a physical health problem exactly, but with a kind of exhaustion and isolation that left unaddressed can become one, right? The pastor has a relationship with a nearby federally qualified health center, and together they've built something simple but powerful. When a congregation member is in distress, the pastor or a trained lay health worker connects them directly to a care coordinator at the health center. Not with a pamphlet, not with a phone number, but with a warm handoff. A real introduction, a scheduled appointment, a person, not a process. The health center assesses the individual, connects them to a behavioral health support, and, this is the critical part, reports back. Not in medical jargon, not months later, but in plain language within an agreed upon time frame. And the pastor finds out, of course. Was the appointment kept? Is the person engaged in care? Is the need resolved? If something falls through, the church knows. If the person stops showing up, the health center knows. The loop stays closed. Because both sides agreed. They agreed in advance on what accountability looks like. And when it works, they measure it together. Not just appointments kept, but stability sustained. Not just referrals made, but lives steady. These are the kind of relationships we must build. Relationships grounded in trust, you heard that word a lot today. Trust sustained by shared language and accountable to shared outcomes. Healthcare cannot succeed without community organizations. Community organizations cannot scale without support from government and healthcare. These are not adjacent systems, they are interdependent. The question is not who owns this piece, it's how do we own this outcome together? And of course, there's an ethical dimension we can't ignore. Allocation is a moral choice. It's often easier and cheaper to serve people already closer to stability. But if we only optimize for efficiency, we leave behind those with the greatest need. So here's the good news. You ready for some good news? Yeah, identify, address, and resolve needs across sectors, we actually make better use of scarce resources. We reduce duplication, we prevent crises instead of reacting to them, and it's quite clear that equity and efficiency are not in conflict. Done right, they reinforce each other. So I know this is not small work. It requires coordination, trust, that word again, trust and discipline, and a whole lot of communication. It requires us to rethink habits that are deeply ingrained. I think that's actually probably the hardest one. But the alternative to this is to keep doing what we've been doing. And I've heard that's a definition of insanity, so we want to stay away from that. We don't want to continue incrementally improving parts of a system that was never designed to deliver the kinds of outcomes we would like now. We don't have the luxury of that anymore. Resources are tighter. The needs are greater. And expectations from the people we serve are higher than ever. Now, to the health system leaders in this room and online, I say we are living through a moment of extraordinary technological investment. AI will save lives. We should pursue it. We absolutely should pursue it. But no algorithm notices the congregation member who has stopped coming to church. No dashboard sits with someone in crisis, takes their hand, and says, I see you. I'm going to stay with you until your issue is resolved. That is human work. And it deserves the same investment that we're pouring into technology. So I ask you to make a commitment. For every dollar invested in AI, ask what is being invested in the community health workers, care coordinators, and case managers who do the work AI cannot do. If you're willing to carry that question back to your organization, can you stand up or raise your hand? Can you do that? All right, I love this. Yes, this is what we need. And if you're online, type your organization's name in chat. This is really important. I hope you took a look at how many people were standing and who they were, because we need to hold each other to this. To the community-based organization leaders who are here, you are the ones who actually close the loop. Not on paper, in real life, with real people, on the hardest days. This work is not auxiliary to healthcare. It is healthcare. You are not extras in this enterprise. You are essential. And you deserve to be resourced accordingly, to have a seat at every table where decisions about this work are made. So one might ask, well, where does this leave all of us? Well, we all have skin in this game. As Dr. Bassan said earlier, everyone is involved in this. Health is everyone's work. Healthcare is everyone's work. And remember, I said mental health is part of that, right? So there is no community-based organization, no business, no government at any level, federal, state, local, that should not be invested in doing this work. But we need to build a shared vocabulary so that data and decisions connect across sectors. We've got to invest in full circle care, move from partnership to shared ownership, there's a big difference, and invest in people as boldly as we invest in technology, because the human element of care is not a supplement to the system. It is the system. The opportunity in front of us is not only to improve access, it is to redefine it. that can deliver on that definition for everyone and at scale. The relationships in this room are proof that it's already beginning. So I thank you again. I really can't thank you enough for what you do, because you are the answer to the challenges we face. So I say it's time to go to happy hour. And let's keep on building on everything that we've heard today. Remember, you are the answer to the challenges we face. Thank you.
Ladies and gentlemen, big round of applause for Chirlane McCray, one of the amazing speakers.